Video 7, Cannabinoids and Risks for Patients. And now I'll review the risks for patients that come with cannabinoid use, beginning with THC. There's certainly a risk of falls with THC use, especially in medically ill patients. There's also the potential for a drug-drug interaction when it comes to THC and some of these drugs, including warfarin, clopidogrel, some antiepileptics, antifungals, and some antibiotics. There's always a risk of unintentional overdose in children or the patient when it comes to THC use. And there should be caution when using THC in patients with a cardiovascular disease because there is a risk of myocardial infarction, which I'll discuss later in this video. The common side effects of THC use include dizziness, intoxication, drowsiness, and it can also induce anxiety and paranoia. When it comes to high doses of CBD, there are fewer risks for patients. There is a potential for liver injury or elevated LFTs, although this is only seen at very high doses, such as 20 milligrams per kilogram, which was given in the study of children with epilepsy. It's important to note that there is a potential for drug-drug interactions, especially with antiepileptics and possibly with warfarin. Other potential side effects of CBD do include sedation, loss of appetite, and GI upset, but this is again usually when it comes to high doses. When it comes to cannabis use, whether it's medical or recreational, it's important to be aware of these risks. The first risk is that of an accident. Because acute intoxication impairs decision-making and physical coordination, there's an increased risk of accidents. And it's important to realize that this isn't just restricted to motor vehicle accidents. Other types of activities, like swimming or biking, can also be dangerous under the effects of acute intoxication. When it comes to overdose, cannabis alone is unlikely to cause a lethal overdose. However, it's important to note that mixing cannabis with other drugs does include the potential for a deadly overdose. Even though cannabis doesn't normally cause an overdose, it can lead to overintoxication, with symptoms like anxiety, paranoia, tachycardia, ataxia, vomiting, and hypotension. It's important to note that when THC is smoked or vaped, it has a peak effect in about 15 minutes. However, oral cannabis products don't have their peak for about 2 hours. This means that people often think that nothing is happening and they keep consuming more, which can lead to unexpected overintoxication hours after taking the dose. A study from Canada showed an increase in emergency department visits due to cannabis use. And this study showed the reasons for those visits. 23% were for hyperemesis, 32% were for cognitive disorder symptoms, and 71% of these emergency room visits were due to cardiac distress. So this leads to an important topic, which is cannabis and cardiovascular risk. It's known that THC raises heart rate, dilates blood vessels, and these effects can make the heart need to work harder. Research studies also indicate that cannabis smoking is associated with an increased risk of having a heart attack. So far, the data has focused on smoked cannabis, and we don't know if this risk applies to oral THC preparations. The data shows that this risk is highest within 60 minutes of smoking cannabis. This risk is likely highest in people who have a history of heart disease. However, some studies show an increased risk of heart attack in young, healthy individuals. Now I'll discuss cannabis and pulmonary health. Regular cannabis smoking is associated with chronic cough and phlegm production. These symptoms generally resolve when smoking stops. To date, the evidence suggests that cannabis is not associated with lung cancer, unless cannabis is mixed with tobacco, which is a common practice. And more research is needed to determine the impact of cannabis smoking on COPD. It's important to note that vaping THC is associated with a severe pulmonary disease called EVALI, which stands for e-cigarette vaping associated lung injury, is associated with vaping THC. Currently, there have been almost 3,000 cases and 68 deaths. Among patients with this disorder, the majority reported vaping THC products, although not all. Some patients with EVALI vaped nicotine only, and 17% of patients reported vaping only CBD. These cases were reported in a wide range of patients, from 14 to 75. And it's now thought that EVALI is caused by a contaminant called vitamin E acetate. So now I'll review the key points. It's crucial to not underestimate the risks of cannabis despite its widespread use. These risks include overintoxication and accidents. In patients with heart disease, smoking cannabis can have a significant risk. In patients with heart disease, there's also a risk of heart attack, especially within an hour of smoking. Cardiac symptoms should be taken very seriously. Vaping e-cigarette products runs the risk of developing a serious lung disorder.